Yeah, that's a good question. I have a lot of people asking about the connection between biking or any kind of activities that are putting pressure on the perineum with elevated PSA and prostate cancer screening. I don't think there's a direct relationship between prostate cancer itself, but I think more of the question is, are we seeing a false elevation in PSA from additional stress or pressure to the prostate from those activities? And I usually recommend waiting at least a couple weeks, 2 to 3 weeks between biking or that type of activity, between checking a PSA. If it's caused an elevated PSA where we're worried it may be a false result. But that being said, I have a lot of patients that come to my office for PSA screening that said they just went on a bike ride the weekend before. And most of the time, it's not a very complicating issue. I did see one interesting study a few years ago that actually looked at biking, and they surveyed about 4,000 patients, and they sent out quality of life questionnaires to these patients and found that there's certain tips when biking that could decrease prostate inflammation: increasing the height of the handlebars, increasing the height of the seat, spending more time standing. And I similarly have a Peloton at home that's very lightly used, and I try to make those